Hi guys, in today's video we're going to be talking about the celiac trunk, which is one of the arteries that supplies the upper GI tract. Okay, so the celiac trunk is an unpaired artery, so it is not a paired artery like your, so for example your renal arteries are paired, but the celiac trunk is actually an unpaired artery, and it originates from the abdominal aorta. Okay, now before we move on, I'm just going to talk a little bit about the different parts of the aorta. So I'm going to draw a rough sketch out to demonstrate that. So if we imagine this round blob over here as the heart, okay, so obviously your heart does not look like that, but in terms of ease, I'm going to do so. Okay, now the part of the aorta that ascends from the heart is known as the ascending aorta. Okay, the arch is known as the arch of the aorta, and obviously that has three main branches that come off it. We have the brachiocephalic artery, we have the left common carotid, and we also have the left subclavian. Okay, and then we have the descending aorta. Okay, so the part that descends down is the descending aorta. Okay, now the descending aorta is made up of two parts. It's made up of the thoracic part, and it's also made up of the abdominal part. Now there is a muscle that splits the thoracic and abdominal aorta, and that is the diaphragm. Okay, so the diaphragm splits the thoracic and the abdominal aorta. Now the aorta pierces the diaphragm at T12. Okay, and that is an important landmark that you should know. One way to remember it is I ate 10 oranges at 12. Okay, so I8 is in reference to the IVC, okay, which pierces the diaphragm at T8. Okay, so 8, right? Then we have the 10 oranges, so we have the esophagus, which pierces the diaphragm at T10. Okay, so obviously the esophagus is sometimes spelled with a O or a E. And then finally we have the at 12 part, which is in reference to the aorta, okay, which pierces the diaphragm at T12. Okay, now before we actually talk about the branches of the celiac trunk, what we're going to do is talk a little bit about the basic anatomy of some of the organs that the celiac trunk supplies, okay, which is mainly the stomach. So we're going to start off by drawing the lower part of the esophagus, and then I'm going to draw the stomach roughly. So obviously this is not anatomically correct, this is not how your stomach exactly looks. Okay, so as you can see I've drawn the stomach there, and now I'm just going to label some of the parts. So we have the lower esophageal sphincter, which controls the movement of content of food from the esophagus into the stomach, and the region that's right next to it is known as the cardia. Okay, now in this diagram it's not portrayed well, but there is a part of the stomach that is slightly above the esophagus, and this is usually on the left of the stomach, and that part is known as the fundus. We have the body of the stomach, and then we have the pylorus. Okay, and we also have a pyloric sphincter, which controls the movement of the stomach, controls the movement of food from the stomach into the duodenum, which is the first part of the small intestine. Okay. Now in the stomach we also have ridges that can be seen with the naked eye, which is designed to improve the surface area of the stomach, and they're called rugae. Okay, so you can actually see them with the naked eye. Now other associated things that you need to be aware of is the pancreas, which is actually posterior to the stomach. Now this is not anatomically correct, it's just a rough sketch. And then next to the stomach we also have the spleen. Okay, so posterior to the stomach we have the pancreas, and then towards the left we also have the spleen. Okay, so the tail of the pancreas pierces in to the hilum of the spleen. Okay, right, now let's talk about solely the celiac trunk. Okay, so the celiac trunk is made up of three main branches. We have the splenic artery, we have the left gastric, okay, left gastric, and we also have the common hepatic. Okay, So I'm going to draw out the rough sketch of the stomach again, so that we can go through the blood supply of the celiac trunk. Okay, so here we go. That's our rough sketch there. As I said, this is not anatomically correct. Okay, the stomach does not look like the drawing. Okay, so the celiac trunk, unpaired artery from the abdominal aorta. Okay, the first branch that comes off it is a splenic artery. Now, the splenic artery is the most tortuous artery in the body. Okay, so you could be asked an exam question, for example, what is the organ that is supplied by the most tortuous artery in the body? And the answer to that would be your spleen, because it's the most tortuous artery. Okay, and it runs posterior. That's why I've done it as a dotted line, because it runs posterior to the stomach. Okay. The other thing to remember is that the pancreas, as we discussed, which is posterior to the stomach as well, lies about just there. Okay. Okay. Now, the thing to remember is that the splenic artery is actually, it runs over the superior border. Okay. So, runs over the superior border of the pancreas. Okay. Superior border of the pancreas, and therefore it actually supplies the pancreas as well, okay, before it moves towards the spleen, okay, which is obviously towards the left of the stomach, as we previously saw. Okay, now the second branch of the celiac trunk, as I said, is the left gastric artery, which supplies the lesser curvature of the stomach. Okay, so this part over here is known as the lesser curvature, okay, because it's a smaller curvature, and this part over here is known as the greater curvature of the stomach. Okay, so the left gastric supplies the left part of the lesser curvature of the stomach. And then finally we have the last branch that comes off the celiac trunk, which is your common hepatic artery. Hepatic means liver, so this artery obviously supplies the liver, and it has two branches. It has a right branch and a left branch. So the right hepatic artery, left hepatic artery. From the common hepatic, we have a branch that descends down like so, and from that we have a branch that supplies the right side of the lesser curvature, and that is known as your right gastric artery. Okay. From your splenic artery, we have a branch that descends down like so, and it supplies the greater curvature of the stomach on the left hand side, and that is known as left gastroomental. Okay, and then we also have a branch that comes from here to join the left gastroomental, and this forms your right gastroomental artery. Okay, and both the gastric arteries and the gastroomental arteries have perforating branches into the stomach. Okay, so they have branches that supply the stomach like so. Okay. Now the thing to remember is that the gastric arteries have a point of anastomosis, and so do the gastroomental arteries. Okay. Now anastomosis basically means where two arteries meet. Okay. Now let's go through some of the other arteries of the celiac, of some of the other branches of the common hepatic artery. Okay, so I'm going to do it in a different colour, just to distinguish between the branches. Okay, so the part over here is known as the gastroduodenal. Okay, so this branch that is descending down from the common hepatic is known as the gastroduodenal artery. And as it descends down, its name actually changes to the pancreaticoduodenal. Okay, pancreaticoduodenal, and specifically the superior pancreaticoduodenal artery. Okay. Now, the thing to remember about the superior pancreaticoduodenal is that it supplies the duodenum up until the half of the second part. Okay, so it doesn't supply, the superior pancreaticoduodenal artery doesn't supply the entire duodenum. It only supplies up till the half of the second part of the duodenum. Okay, and it has two branches. It has an anterior branch. Okay, so the anterior branch of the superior pancreaticoduodenal, so anterior superior pancreaticoduodenal, and it also has a posterior branch, okay, which is known as the posterior superior pancreaticoduodenal artery. okay, and that would be your posterior branch. Okay, so that is it for the celiac trunk. In the next video we will discuss the blood supply of the lower GI tract, which is done by the superior mesenteric artery and the inferior mesenteric artery. Okay, to summarize, the celiac trunk is an unpaired artery from the abdominal aorta, okay, and it has 3 branches: the splenic, the left gastric, and the common hepatic artery. Thank you.